So once you have demonstrated that your process presents all the required efficacy, it's interesting to focus on specific microorganisms which are of medical interest or because they represent a real challenge. This is the case for bacterial spores. As you know, they are considered to be the most resistant microorganism, and they are used to demonstrate the efficacy of sterilization processes or, according to US regulation, to qualify a chemical as a sterile. According to the study we have published in 2022, we clearly demonstrate that UVC disinfection process inactivated spores within 90 seconds with a 6.2 log reduction within only 84 seconds. Furthermore, this study clearly indicates that the UVC unit was much more effective than usual FDA-approved chemical high-level disinfectant product to kill spores in real-use conditions. So another time, we demonstrate that UVC disinfection process can achieve the same efficacy level and even more on bacterial spores than already clear chemical disinfectant. To finish, I would like to spend a few minutes on the paper published by Mayer in 2017, who suggest that healthcare facilities using endocavity ultrasound probes need to strongly consider disinfection methods that are effective against HPV. In this study, Mayer demonstrates that the UVC irradiation is an effective disinfectant method to inactivate human papillomaviruses, whereas some common disinfectant may be less efficient.
Let's talk about the in-use clinical test. This is a first-in-study research on human papillomavirus, HPV, conducted in a clinical environment. The objective of the study was to determine if ultraviolet light C spectrum, UVC disinfection, is more efficient than low-level disinfection in routine clinical conditions, especially against HPV. The study compared two protocols usually found in infection prevention practice when using endocavity ultrasound probes. The simple protocol consisted of performing low-level disinfection with a chemically impregnated wipe on a probe used with the disposable cover. The more rigorous protocol consisted of performing high-level disinfection on a probe that was partially cleaned. To the right, you can see this paper by Maxime Pinchon, titled Decontamination of Intravaginal Probes Infected by HPV Using UVC Decontamination System. Now, the key results of this study showed the following outcomes. All 47 probe covers were intact, no visible damage, although, as we've already seen, they can often be damaged, and positive human and HPV DNA. Simple protocol cleaned and wiped with low-level disinfectant. 8 probes were positive for human or viral DNA, 7 probes with human DNA, and 1 with high-grade HPV 51. Now, with the rigorous protocol, UVC disinfection was applied only to partially clean probes. All probes were found to be negative. The UVC HLD procedure was found to be statistically more efficient than low-level disinfection, with a p-value less than 0.05. In the upper right, you can see actually a chart that demonstrates these numbers. Again, human DNA, chemical disinfection, positive 7 out of 47, approximately 15%. Ultraviolet disinfection is 0 over 47, 0%. HPV DNA found in 1 over 47, 2.1% with chemical disinfection, found in 0 over 47 with ultraviolet disinfection, 0%. This research confirmed that UVC high-level disinfection is more efficient for ultrasound probe disinfection than low-level disinfection in a clinical use test, highlighting that UVC high-level disinfection is an easily adaptable solution to a clinical healthcare environment. Well, let's now talk about evaluation of a new UVC-based high-level disinfection method. HLD has traditionally been performed using chemical products such as glutaraldehyde, peracetic acid, hydrogen peroxide, or orthothialdehyde, all of which have drawbacks. Recently, automated systems based on UVC irradiation have been approved in several countries for HLD on non-lumen devices such as vaginal, rectal, and surface ultrasound probes. In this study, we evaluated one UVC device, the Hypernova Chronos system, Germatech, using U.S. Food and Drug Administration, FDA, requirements criteria for liquid chemical sterilants, which are also high-level disinfectants for assessing potency carrier tests and simulated use tests. So evaluation of a new UVC-based high-level disinfection method revealed the following. We'll start with potency tests. Evaluated HLD efficacy, that is log 10 reduction, using the Hypernova Chronos system, using its standard cycle, and achieved the following results against selected microbes by inoculating a predefined area of silicon carriers, except for viruses where glass Petri dishes were used. Bacteria, greater than 6 log reduction. Fungus, greater than 4.7 log reduction. Viruses, greater than 4 log reduction. And mycobacteria, greater than 6 log reduction. Now let's turn to simulated use tests. This involved inoculation of 5 different ultrasound probe types, each tested 5 times with an efficacy target of greater than 6 log 10 reduction of Mycobacterium terrae in the presence of organic, that is 5% calf serum, and inorganic, that is 400 parts per million of calcium chloride, calcium CO2-3, interfering substances. All potency tests met or exceeded the threshold requirements for microbial reduction of HLD. And I should note the inorganic load and the organic load would correspond to failure to clean the device after use prior to high-level disinfection. Importantly, no growth of microorganisms were observed in any of the simulated use test samples. The conclusion, based on methods adopted for a UVC disinfection unit, the data presented showed that Hypernova Chronos system can be deemed to be compliant with US FDA requirements applicable to chemical high-level disinfection. Well, let's talk about mythbusters and insights, shedding a light on UVC technologies in the hospital environment. On the right, we have a recently published paper entitled Shedding a Light on UVC Technologies in the Hospital Environment. In this review of UVC technologies by Dr. Demirsamin and colleagues, we would like to express several concerns with this review. First, the authors appropriately list some of the parameters that affect the effectiveness of UVC irradiation for disinfection. Although beyond the scope of their review, it should be noted that similar factors affect the effectiveness of chemical disinfectants, including concentration, time, duration, temperature, inherent microbial resistance, and the need for the chemical to have direct contact with the microbe. Second, with regard to room disinfection devices, the authors state that most studies reported a 1 to 2 log reduction in microbes on the surface. While this statement is correct, it is also misleading. Studies have demonstrated that UVC room disinfection devices can achieve greater than 3 log of reduction of multi-drug resistant vegetative bacteria placed in carriers. The reason that most studies only show a 1 to 2 log reduction is because that's the average load of microbes on environmental surfaces. And so even if you remove all the microbes, it's still generally only 1 to 2 logs. Third, as noted in the review, HLD requires a greater than 6 log inactivation of microbes. This can be achieved in a sealed closed chamber by UVC for non-lumen endocavity endoscopes, as the distance between the UV source and device is very small. Importantly, UVC energy decreases as a squared function of distance. In fact, one UVC device used for high-level disinfection of endocavity ultrasound probes has been demonstrated to achieve greater than 6 log decrease in microbes, including spore formers such as Bacillus subtilis, thus meeting the criteria for HLD. Fourth, the authors correctly note at the present, a UVC device for HLD has not been approved by the U.S. Food and Drug Administration for HLD of microbial devices. However, they failed to mention that one such device has been approved for HLD of non-lumen endocavity probes by regulatory authorities in France, Canada, and Australia. Finally, the lead author stated that the authors of the paper on UVC disinfection devices for HLD of endocavity probes have a conflict of interest. We take umbrage at this inference that such papers are biased or not scientifically accurate. We note that the authors of these publications disclosed the conflicts and that the papers were peer-reviewed and accepted by the editors. Now, finally, Mythbusters in review of two studies. On the light, you see disinfection of transvaginal ultrasound probes in a clinical setting, comparative performance of automated and manual reprocessing methods. On the right, disinfection of transvaginal ultrasound probes by UVC, a clinical evaluation of automated and manual reprocessing methods. The study protocols between these papers were not the same, so it's not possible to directly compare the results of the data in these two studies. Again, you have to, if you're going to compare data between two studies, they have to use identical methodologies. So finally, ultraviolet germicidal radiation for high-level disinfection of ultrasound probes has been demonstrated to be highly effective in multiple different in vitro tests and in actual practice. Thank you very much for the ability to talk to you today and for listening to this important presentation.
Thank you, Dr. Lionel Panu and Professor David Weber, for your presentations. On behalf of Germitech, we would like to thank the people that participated in today's webinar. Thank you and enjoy the rest of your day.